So good afternoon, everybody. This is Karen Lee Harrington with the Maine Health Data Organization, and I think we're going to just give it another minute. There are some folks still dialing in, so we'll get started in about one more minute. Okay, so I think we're going to go ahead and get started. Again, good afternoon, everybody. My name is Karen Lee Harrington, and I'm with the Maine Health Data Organization. I'd like to welcome you all today. Thank you for taking time out of your busy schedules to join us on our Hospital Data Submitter webinar. It's scheduled to go until 2 o'clock, and so we're going to jump right into it. I'm going to be presenting a number of the items on the agenda, and a colleague of mine will also be presenting, Leanne Candora. She is the lead consultant that we're working with, running the program, and she's with Human Service Research Institute. So between the two of us, we will work through a deck that hopefully you're all logged into the webinar you are seeing online. Just a couple of housekeeping notes. We are recording this webinar, and both the recording and the deck will be available on our website for those of you that want to refer to it after this meeting and or share it with other colleagues within your organizations. Just another quick housekeeping item. If anybody needs to leave the call for whatever reasons, if you could just not put us on hold, that would be great. We did not mute the phones, so the phone lines are all open, but if you could mute and not put us on hold, that would be much appreciated. And then lastly, with the tight agenda that we have, recognizing that you all have busy schedules, we have only scheduled an hour. So what we'd like to do is ask that you submit via the chat feature any questions that you have as we go through the various agenda items. At the end of this meeting, if we have time, we will answer some of the questions that we've received, but what we will absolutely do is respond in writing. So we'll document the question and what our response is, and we will make that available on our website. And we will send you all, after this session, a link to the page on our website where all of this information will be kept. So with that, I'd just like to take a minute and run through the items that we want to cover today. So we have, I think, worked through the welcome. We'd like to talk through, at a high level, what the Maine Health Data Organization's transformation effort is all about and sort of the rationale behind it. We'd like to spend some time providing you with some information in terms of the survey that many of you took and the feedback that we received. We'd like to walk through an overview of our proposed new data submission process, some of the technology requirements, our timeline, future communications, and then we'll close. So in terms of what is transformation and what does it mean to the Maine Health Data Organization and to our customers, and we do think of our data submitters as well as our data users as our customers. And back in 2012, the Maine Health Data Organization's Board of Directors took action relative to some criticism that the agency was getting in terms of its operations, systems, and processes. And so the result of that criticism was to enter into a contractual arrangement with our consulting group that is working with us to identify areas where we can better run our operations. So we're looking to gain efficiencies, to leverage newer technologies, to re-examine all of our processes, and again, to ultimately produce a better intake and outtake. So better intake for our data submitters and better outtake for those that are using the data for a variety of reasons. And to ultimately be able to be nimble and flexible enough to change as the needs in the market change. So the MHDO board set out a vision for this transformation, and they basically, as illustrated on slide 6, have said that our goal is to become a data provider to our clients and the public in a manner that's responsive and timely, and I won't define all of these things, but that the data coming in and going out is accurate, it's accessible, streamlined, and secure. So these have been sort of our guiding principles as we've been working through the various elements of our transformation. So over the last year and a half or so, we've been spending much of our time in terms of our transformation work working on developing a portal for the health plans that are submitting claims data to the MHDO. And so we have spent, as I said, a year and a half or so working on designing, testing, and launching that system. And we're now ready to move to looking at the way our hospital data is submitted and how it's validated and how it's ultimately released to end users. And so similar to the work we did with the health plans and building the claims portal, we now are ready to work with the hospitals and build our new portal for the submission of hospital data. So a big reason behind the survey that we sent out was to get a sense from you all that are on the front line dealing with this data every day. And for many of our hospital data submitters, you've been doing this for 20, 30 years, is to get from your perspective what the challenges, what the opportunities, what the benefits are with our current system that we want to make sure we address and or maintain to the extent possible in our new system. And so again, the ultimate goal here is to design a system that better meets the needs of the data submitters and the end users. As part of this whole process, we'll be reviewing and updating Rule Chapter 241, which I know many of you are aware of what that rule is, but for those of you that are not, it's the MHDO rule that governs the submission of both inpatient and outpatient hospital data to the MHDO. And so with that, I'm going to turn things over to Leanne, and she's going to walk us through the next couple of agenda items, starting with feedback from the survey.
Thank you, Karen Lee. So as Karen Lee mentioned, many of you were able to participate in the survey that we had sent out beginning of April. We invited 39 hospitals. 21 of those hospitals did respond, which gave us approximately a little over 50% response rate. So what I'm going to be doing over the next couple of minutes is just going through some of the feedback that we received from the survey, and also throughout the review of the feedback, what we're going to try to do is start to address some of our thoughts on either the issues or the challenges that current system users face, and also acknowledge some of the things that people like about the current system. This is really the first step in building what we're calling a custom system for the MHDO that allows data submitters from the hospitals to get their data over to MHDO, so then it can be eventually released to approved data users. And we want to make sure that we build a system that works for all the stakeholders and really integrate their feedback into all steps of the process. So this survey is really kind of the first step in getting a baseline of understanding about what's currently working and what are areas that we can improve. And so if we're going to, let's move to the next slide. So the first one is just focusing on what system features that data users, data submitters would really like to preserve about the current database check system. We heard from data users that the 24-hour access and the speed of the transmissions of the data was really important, that was working well within the current system, that there was a clear explanation in the system of any data errors, and that it was user-friendly and intuitive. Also in the reports, they thought the summary and detailed reports of the errors were really helpful, and the ability to download detail from any errors that were received in the system so they can send it internally to other departments for resolution. This was also an important feature that they would like us to look to preserve in the new system. So submission time, this was an area that we were really interested in learning more about. So for the typical submission, most respondents, 76%, said it took 5 or more hours to correct any submission errors. And areas for improvement include the amount of time required to report and resolve issues. And so taking this in consideration, the issue resolution new system will be very different from the current system, with the goal of decreasing the amount of time needed to address errors. And I will get in more detail in the next section of this presentation about what some of our ideas that we're proposing for the new system and how this might be addressed. So another part of the survey was on the submission of data. The suggestions are in areas to improve with the ability to send data monthly, to better align Chapter 241 with the billing format changes, so keeping it more up to date, and eliminate file overwriting feature of the current system. And some of our planned resolutions for these areas are that hospitals will have the option to submit monthly or quarterly data. We think we can provide both options in the future system. And also for Chapter 241, the MHGO is committed to updating it annually and or as needed. And we'll get into more detail about this and further on in the presentation. So the next area was the corrections edit process. We understand that this is a time-consuming part of the data submission process, and that moving between or within edits and making corrections can take considerable amount of time depending on the submission. There is a suggestion that the system should be able to suggest appropriate corrections. So when an error is received, that there might be a way for the system to indicate what a possible correction would be that would allow the data to be submitted into the system, and to fix the zip code and town file so they recognize out-of-country addresses. So some ideas for plan resolution for these issues are the new system will be very different, and there will be no online corrections to data in the same way that the database system is currently operating. And again, we'll get a little more detail in that in the next section, and this is also one of the areas that we're looking for feedback from current data submitters. And finally, the zip code and town validation lists we'll make sure that we keep these up to date and in the system, and make sure that when errors do occur, that they're easy for a data user to understand what they can do to correct them. So in the reporting section, the suggestions and areas to improve are the log of accepted files. They want to be able to see what with the quarter and year submitted, being able to see that the file that was submitted and know where it is in the system, that it's locked and safe, and no chance of it being overwritten or disappearing, and more information about what it means on specific errors. So again, the new system will have submission history where users can view submitted files and the current file status, whether it's processing, whether it's in a failed status, which means errors exist, or where it's been passed into the data warehouse. Again, we do understand that it's an issue if files disappear, and that would never be the intention of the new system to allow that to happen. So we'll make sure we understand the current issues to be able to plan for them in the future system. The next section is the training and help desk. Some suggestions were to provide webinars and trainings, screenshots and support staff, faster turnaround times on issues, and creating a test environment where data submitters can use when needed. So our plan for the new system is that webinars will be held prior to system launches, and those webinars will be recorded and made available. Training videos will also be made available. There will be step-by-step user guides with screenshots available on the website, and that there will be a help desk that will be accessible via email or web or phone 8 to 5 days a week. So we did receive some specific questions as part of the survey process, and I know we have some information on the screens. I will go through a couple of these questions, and again, we can also add these questions to a running list that we'll be collecting during this webinar and after. So this question is about the delay, a possible delay in making corrections to the data. There was an indication that the process takes hours and that a staff may block off time in the schedule to work on the files, and if the delay in getting information will create a work schedule issue. And so in us trying to understand this issue better, we're trying to compare what the current process is to our future process, and there will be a difference in how data are what we're calling validated and then potentially corrected. So once the data are submitted, data users will receive an email notification as soon as the file has been processed, and then a link will be provided so a data submitter can view data issues. So this may be different than the current process. We feel that what we're able to propose at this point is that data are usually validated. We guarantee within 24 hours. It typically, we predict, will take less than an hour. And that if there is issues within the system, that you'll be able to override them online, and that it will be a different workflow. And I'm hoping that the next section of the webinar will address this in more detail and potentially either create more questions or alleviate some concerns about workflow process. So I think that there will be differences in approaches that a staff may need to take in the new system, but we're hoping that it will take less time at the end. So the next question, would a complete data file have to be created in order to correct one or two accounts? Current editing allows for a correct all. When you have multiple errors of the same type, will the new process allow for this? So our response to this will depend on the type of validation. If only a few records are not passing, a user may be able to get their data into the data without having to actually correct those data fields. And again, I'll get more detail in the next section of this presentation on how this might work. Next question, would you consider suggestions from data submitters after the implementation is done? Our response is we'll have a test period that hospitals will be invited to participate in. Feedback will be gathered during and after the test period to incorporate changes into the final system. The system is live. We will continue to collect feedback and also review feedback received through the help desk, as well as a satisfaction survey that will be sent to users about 6 months after launching the new system. And then we'll use the feedback to discuss potential improvements to the system. And we're really committed to receiving and then using feedback that data submitters pass on to us through the various opportunities that we're going to give them along the way. So finally, what everyone's been waiting for, the overview of the proposed process. I know some of the last section may have been a little confusing about us letting you know how we're proposing to do some of the future changes without going through how we propose this new process to work. So as you see in the current screen, what we have is you, the hospital data submitter, will be using the MHDO web portal to submit your data. Now this is probably somewhat similar to how you are working within the database check system now. You go to a website, and on that website you can upload your data, and then what happens once the data is uploaded is that it goes through a data validation and a data processing and validation step, and then once it's passed all of those steps, it goes through to the MHDO data warehouse. The secure portal is available 24/7 and will allow hospitals to submit data and validate the data through an interactive interface developed with your feedback and testing input. To reduce the burden on submitters and improve data quality, we will use a system where validation feedback can be obtained quickly and the security of sensitive information can be ensured with a minimal burden on server resources. So the process, as I'm going to describe it, is a four-step process. The first step will be registration. Step 2 will be the data submission. Step 3 is the data processing and validation. And finally, step 4 is data is then passed to the MHDO data warehouse. The first step is going to be registration. So now that we are building a new system, we are going to require that every hospital must register in the new system prior to the data submission period being open. There are a number of system roles that hospital users can be assigned to. Every hospital must have an administrative contact who can grant permissions for other system roles. So we'll be asking this to be the first person within the hospital system to register will be the administrative contact. The administrative contact will be responsible for making sure everyone else in their hospital or company is identified and registered in the system. As you can see, the system roles include administrative, compliance, technical, and then outpatient and inpatient data submitters. MHDO has assigned each hospital an identification code, and this will be used in the new system as well for reference and to use when naming files for submission. There may also be additional questions during the registration process that hospitals will be asked to respond to. Step 2 is data submission. Data submissions will be made online in the MHDO web portal via upload. Files must be compressed and encrypted before submission. I'll talk a little more later in the presentation about what our requirements around compression and encryption are. Portal users must be assigned either an administrative or data submitter role in the web portal to be allowed to submit data. Data can be submitted monthly or quarterly, and data will be submitted in the same file format as currently required, which is according to Chapter 241 specification. So the next step after data submission is, I think, one of the most important ones that we're going to spend a majority of the rest of the time focusing on, as we think that there might be changes during the data processing and validation step that are very different than how you're used to dealing within the database check system. We're really hoping that this can improve both the speed in which data submissions can be made from the hospitals to pass status within MHDO. And we're, again, also looking for any feedbacks or concerns you may have about what we're proposing today. So step 3, data processing and validation. All hospital data submitted to the MHDO web portal will be evaluated against a set of data validations before they are allowed into the MHDO data warehouse. I believe this step in the process currently may be called checks, and we think the data validation process is very similar to the current check process. So the validation process will produce a set of validation issues that must be resolved before data are accepted into the MHDO warehouse. And so these issues are what, in the current system, are called errors. So validations in the new system, again, this is similar to the checks and the errors in the current system. It will be a tailored set of validations for hospital data. Many of these validations will be based off the current checks that are in the database system, but they will also be reviewed for any potential changes or suggestions from the current workflow that are not producing higher quality data. And so what the real goal is that these validations just work with both the hospitals and the data users to produce higher quality data. All data submissions will be evaluated against the validation set, and there's 3 different types of validations: structural, exemption, and profile, and each function a little differently within the system, and I'll go through in more detail what each of these validation types how each validation type operates. This list of validation issues will be made available to hospital data submitters at least 6 months before the web portal is live. We want to make sure that this whole process is very transparent. We will not be doing anything to your data, evaluating your data in any way that you will not be made aware of prior to the changeover in the system. And so we think it's really important that we give you enough time to review all of the validations that your data will be judged against in the final system, so you'll be well prepared and have the expectations set for when you do start submitting your data beginning next year to the new system. So now I'm going to go to the process overview. The hospital data validation system will be designed to be user-friendly, allowing data submitters to resolve issues quickly and easily. All files will be validated within 24 hours with an average time of less than an hour, and you'll receive an email notification whether your file has passed or has issues. Again, currently referred to as correctable edits or rejections. The submitter can view all issues in the portal. There are some issues such as structural issues. An example would be your file does not contain the correct number of fields that will require resubmission of the data file to proceed. Issues that impact data quality will require hospitals to address and may require a resubmission of the data files. MHDO will work with hospital data experts and data submitters to establish these validations and thresholds and make sure, and again, we'll make them available. So while our vision for the new system is that you will no longer be able to go online through an editor and change your data, the goal of the new system is really that the quality of the data that is being judged against is in the hands of the data submitter, and that the only things that would make the data unusable would be completely rejected for resubmission. And we want to make these validations user-friendly and create ways that in the new process that allow data submitters to have more control over which data fields that may not be populated 100% or with 100% corrected fields. There may be a way in the system that those are notated and then allowed through. So going through the different types of validation issues, the first one is really the first level of check within the system is structural data issues. This usually occur when a file fails to meet a required file format, so it doesn't meet the requirements of Chapter 241, and it will typically prevent the use or the further evaluation of the data. The only way to resolve this structural level issue, if your data has a structural level issue, is to correct the file format and resubmit the file with the next version number. And so we'll also get a little more into file naming. I think it may be in a future presentation, but file naming will be very important in the new system because it allows us to understand more the information that is in the file. So again, a structural level issue usually a structural level issue does not allow us to further evaluate the data within the file, and so a file will be usually rejected and have to be fixed and resubmitted. The next validation issue is what we're calling an exemption level issue, and these are generally for required fields. And so there may be certain fields like a CPT code or ICD-9 code where it's a required field to be filled in. There is a list that we can check the codes against, and if the code is not correct, say 99% of the time, it does not meet the standard of a format for that code, is not on the existing code set, you will get a validation, exemption level validation issue. MHDO may agree to allow submitters to override certain issues on a case-by-case basis. These exemptions from a default threshold are typically limited to a period of time. So If you have an issue within your system that doesn't allow you to fill in, say, a code set in the way that it's required, MHDO may allow you to continue to submit files, and having that information notated in the system will not block that file from being submitted. And so it's a way within the system to notate your file to get MHDO approval for the data to continue in to a pass status without having to resubmit the file or correct the data at this point. And finally, we have a set of validation issues called profile level. They apply to validations on elements that can vary by nature of a submitter's business. So a certain hospital may not be expected to fill in a certain field the same way as other hospitals, and so we are going to allow some control at the hospital level of which validations they should be able to be judged against for a certain period of time, and we call this the hospital profile. And so what would happen is the hospital would set up their profile within the system. There are certain fields that the hospital can pass a validation without having to correct their data, maybe make a note about why their data shouldn't be judged against this validation in a certain way, and that the data then can get through to pass status without correcting any of the data or changing any of the data. And once this is in place, all data for that hospital can be submitted on a calendar year without having to reevaluate that validation issue. So this will appear once. A hospital can put in a reason why their data shouldn't be evaluated against the validation, and then for that entire year they won't receive that issue again. So the next is just a little more information about the validation process. I think I mentioned this earlier. So once a file is submitted, it will be validated within 24 hours, but typically less than an hour. And the appropriate users within the system will be notified via email of whether the file has passed with no issues or has failed, and it will tell them the number of issues found. What they then do is go into the MHDO web portal. They can access an issues report, a validation issues report. So once they log into the portal, they can go to the report and they can view the details of any of the validation issues and then resolve the validation issues by either submitting what we're calling an override, so which is the override is the reason that they can't meet the criteria of the validation, or the other way to resolve it would be resubmission of the data once it's fixed. So if correcting the data and resubmitting is not feasible, you'll have the option to override non-structural issues within the system. So data overrides, both at the exemption and profile level, will automatically expire at the end of each calendar year. So once data submitters start with this new system next year, they can set up their hospital data profiles, they can view all the validations that their data will be judged against, they can submit data and see how it performs against the validations, and once they set their overrides, the profile level overrides will be in place for the whole calendar year. They will not receive those issues again until we set a new evaluation for the next calendar year. This is just a way for us to make sure that every year data are reevaluated, and that if there were issues the prior year, that they're made sure that within their system, maybe they can then meet that validation and the override no longer needs to be in place. So we just keep that annual check just so we can ensure that the process continues. So step 4, once you've passed all of your validations and your data has now, your list of issues is now cleared, the data is passed into the MHDO data warehouse. Data are then aggregated across hospitals and then released by MHDO to approved data users. And this process will be somewhat similar to the current process of data release. So finally, there will be a report in the online portal that includes a submission history where users will have the ability to view a complete summary of their submission history and the status of each file. So this is either their monthly submission or their quarterly, and whether it's in failed or passed status of each file. Users can view a detailed history of their validation results of all their files, which ones they resubmitted, where they canceled. Files will be moved to the data warehouse and released only after the file has the status of passed. So the next section is just giving some information around the technology requirements that we are seeing for the new system. There will be certain browsers and settings that the web portal will be optimized to, and the currently supported browsers are Internet Explorer 8 and later, Mozilla Firefox, Apple Safari, and Google Chrome. And so when we're building the system and any system updates, these are the browsers that it's tested against to ensure that it's going to work correctly. And then we also have a list of minimum required browser settings for the portal to be viewed in the right way and for all system functionality to be working. And we'll continue to publish this list of information as we lead up to portal release. We also wanted to give some information about when email notifications are sent out, what the emails will be coming from, and to make sure that these emails don't get blocked within your email system. So whether that's to put on a whitelist or just to approve the portal email address. And again, this will be something that we'll continue to remind you about leading up to the launch of the portal. Now, one other item I did want to touch on, I mentioned this briefly earlier. One of the requirements of the new system for system security when you're uploading your data is that all data are encrypted and compressed before submission. And MHGO will require submitters to compress or encrypt, or this will be a structural level issue. And we accept this can be accomplished by a number of industry standard tools such as WinZip or 7-Zip, many of which you may already be using in your workplace. Each file that is uploaded should be added to a separate zip archive, and archives must be encrypted. And we'll be providing a unique encryption password once the portal is launched, and this will be unique to each hospital account. So again, more information will be coming on this. We just wanted to let everyone know that this is a new requirement that you haven't seen previously. And finally, we just wanted to give you a little more information about the data warehouse security and storage. During file submission, hospitals will submit through the data warehouse portal, the web portal, which is HTTPS, which uses the Secure Sockets Layer SSL protocol. And that the storage, all data is transferred directly to servers controlled by our partner, NORC at the University of Chicago. MHGO is contracted with both Human Services Research Institute and NORC, and NORC houses all of the data in their secure data enclave. Data are validated and stored securely entirely within NORC secure data enclave. And this is also the same place where all the hospital claims data from all the payers within the state data secured. It's the same process through a similar portal, and then lives within the enclave. And that's it from the sections that I'm going through. At this point, I'm going to hand it back over to Karen Lee to go over the timeline.
Great, thank you. So lots of information provided to you in a very short period of time. And I just want to reinforce that this is not the end of this discussion. This is really the launch and the beginning of. And for those individuals that may be interested in talking with us more on a one-on-one, I'm happy to do that and arrange for that. My contact information is at the end of this presentation, and we'll go through other ways that you can get in touch with us. But for anybody that is interested in talking with us directly, we'd be happy to do that. In fact, we have had a couple of conversations with several hospitals over the last week or so just talking through some of the specifics in a little more detail. So want to throw that out there. And again, our commitment through this process is we understand that you all are very, very busy people and you have a lot of different things that you have to do, and this is just one of a long list. And so our goal is to try and keep the communication open and ongoing and frequent, so you know if you're not talking with us directly, you know what's going on through various communications. And we will again send you the link to the page on our website where we will post information on an ongoing basis so people understand where we're at in the process. And we will also schedule, whether it's bi-monthly or quarterly webinars, we will have a formal report out, briefing, if you will, on an ongoing basis. So with that, I want to talk about, again, at a high level, the timeline. And so one of the items that we talked about earlier is Chapter 241 and anticipated changes that we want to recommend the MHDO board make, and if they agree, they will then authorize us to move forward with the rulemaking process. And our goal is to get those proposed changes to the board in July, and those changes would hopefully go into effect in November, but it would not be effective in your data submission. Any changes would not go into effect until the 1st of 2016. We want to do everything on a, to the extent possible, calendar year basis. So we are anticipating that the final submission to our current system will be for your Q3 2015 data. We will then have a test site, and our thinking around that is the test site will be available in April with a go-live date of July 2016. So these are kind of directionally what we're thinking, and my feeling is as the next month moves along and we get a better sense of, you know, some of the feedback from you all, how that may impact our thinking in the design, we may be resetting these dates. But I think, I'm hoping, my fingers are crossed, that this is a pretty accurate reflection of where we're going to be over the next 12 or so months. And then lastly, just an overview of timelines. I won't get into all of this other than to say that we are thankful for the 21 hospitals that took the time to complete the survey. And for those of you that we've had direct conversations with, thank you. Your insight and feedback has been very instructive. And I'm hopeful that as this project picks up and continues on, if there are others that are interested in having conversations with us, please reach out to me. On the last page, if we move on to the next, you'll see my email address is at the bottom, and then you can also send additional questions or comments via the email address webcontact@mhdo@maine.gov. And if you indicate in the subject line that you're a hospital data submitter, the email will get to the right place. So with that, I'm always happy to say that we have not run over. We do have some time. I'm not sure if we've got some questions online.
No, and I gotta go.
Hey, have we received any questions through the chat feature?
I'm checking right now, but let me. You don't hear the.
Oh, yes, I do.
You do.
Right there. I could barely hear this I turned it up as loud as I could, and I could barely hear it. Barely hear it.
I can barely hear my phone when it's. So while Kate's looking to see if there are any questions that have been submitted online, I know there are a lot of people on the phone, and this is sometimes very difficult to do, and that's why we opted for the online way to submit questions. But are there any questions from anybody on the phone that you want to throw out there? We may not have the answer, but if you want to put it out there.
Okay. We have guests. They're here a little bit early. Yeah, it is. They call me.
Help one to the bathroom.
Oh, are they old?
We have a question. We also submitted it on the chat line. Will you make the slides available on the website or by email?
Yes. So we've recorded this webinar, so the recording along with the deck will be available on our website, and after this call we will send a link to the participants to the website where all this information will be housed. And then I see a question, will the new system be ICD-10 compatible? And the answer to that is absolutely yes. And a question, what is the nature of the proposed changes to Chapter 241? I think that the primary changes to 241 fall into the category of aligning with national, whether it be national definitions, national standards. Unfortunately, I don't think that we have kept up with Chapter 241 from that perspective. We did make some changes to it, to the rule a year or so ago to accommodate the changes with ICD-9 going to ICD-10, but we didn't really, do a full in-depth analysis of looking at the different definitions and standards and making sure that that still aligns with national definitions and standards. So that's what that primarily will be addressing and updating.
And there are a number of questions about the rollout of ICD-10. I think this is one of the reasons for the timing of the new system being planned for October of 2015 data, is that the transition will be along the lines of when the ICD-10 rollout goes in place in October. I guess if it goes in place in October, but that's still the plan. And so the data system will be open in the spring, but the first data that will be submitted through the new system will be starting with October of 2015. At least that is the plan at this point.
And for those, I'll just throw out there, for those of you that, I think, David, correct me if I'm wrong, but I think we've got about 8 or 9 hospitals that responded to our email that we sent out regarding any interest in testing ICD-10 now. And we've got about, I think, as I said, 8 or 9 hospitals that registered, and they are working with us in testing ICD-10. So, and if anybody else is interested in that, we can certainly, and you didn't register, if you're not part of the original 8 or 9, let us know, and we can certainly talk to you about getting on the list.
But there, as we mentioned earlier, there will be a testing period with the new system where you'll also be able to test the file formats and the validation and the new system using that format.
Just a quick question. For those that did register to test with the current MHDO system, when will that coordination be happening?
So we have, David, we sent out an email with kind of the requirements and the timeline.
Correct. And at this point, the system is prepared to accept the test files beginning last Wednesday.
And so in the link that we send out with the information regarding today's discussion, in that link is the information regarding the testing and the process. And so if there are any additional questions, you can take a look at that. And if you have any questions after, certainly give us a call.
Okay, thank you.
So there's a comment that just came in about a concern with submitting Q4 data in July. Normally it is due in the month or end of March, early April. And that's something that we've been talking about internally, and I will be addressing with the MHDO board. We too have some concerns with it coming in a quarter behind, but at the same time we recognize that system changes are hard. As much as you plan for, and I know many of you have experienced this yourselves, there are always issues and challenges along the way, and so we're trying to balance timeliness with this initial launch and making sure we get it right. So I think, the concern is noted, and we will definitely follow up after discussing this with the board and getting a sense of their perspective on this. Okay, well, there are no other questions that have come in online. Again, I would encourage you, if you do have questions or you do want to talk to us directly, please send me an email. I would be happy to set that up and welcome the opportunity to talk with you. And again, I want to thank all of you. I know you're very busy. I appreciate the time, and we will be in touch very soon. Thanks, everybody.